I'm a physician. I was practicing traditional medicine. And around 6 years ago, I started to become very disillusioned with medicine because people just weren't getting better. And around that time, I also started seeing all this science emerging around precision medicine and genomics. And it looked to me like for the first time, we truly could personalize every treatment down to the level of someone's DNA, not just which medications may or may not work for them, but also supplements and what diet, exercise, sleep. We could personalize everything. So, the co-founder of Wild Health and I, Mike Mallon, we dove in, we sequenced our own genetics, and around that time, he had a really difficult medical issue that came up as well. He found that his lipids were through the roof, like really dangerous levels. So he saw his doctor. His doctor told him to do a specific diet that works for most people, but Mike's not most people. He got worse. He's Mike. He's an individual. His doctor then wanted to start him on a statin, which it works for most people, but again, Mike had really bad muscle breakdown myopathy, didn't tolerate it at all, really difficult course. And as he's going through this, we looked at his genetics and we saw that, wow, he has all these specific sensitivities around food that make him probably need the exact opposite diet of what his doctor had put him on. And he had a very specific gene that made him almost guaranteed to get that muscle breakdown and myopathy from the statin. And we were really kind of angry at first, like, why did he have to go through this? And then we realized, oh yeah, even though the science is here, no one is practicing this way. Like, we're not putting it into practice. So we left our university positions, started doing this for friends and family. I saw my mother is one of our first patients. I looked at her genetics. My grandmother had just passed away from dementia. And sure enough, my mother had an ApoE4 gene, which makes her about three times more likely to get dementia. And she had insulin resistance, was obese. And so we put her on the program. We sequenced her DNA, did a ton of blood work, looking at all the things that make you feel and perform a certain way now, collected all kinds of other information, took all of these data points, developed a personalized plan for her when it came to food, exercise, sleep, supplements. And in 3 months, she lost 40 pounds, reversed her insulin resistance, and said that she felt 20 years younger. Mike, we put his mother on the program. She lost 80 pounds, got off all of her chronic medications. And since then, we've seen thousands of patients, and we've published on our results, and we get similar results. Like, when you personalize down to the level of the DNA, people do really well.
Yeah, and something that I was doing that was making things worse was I was eating a lot of wild animal protein, which is fantastic. However, it was a lot of the bison, the elk, the deer that had a lot of it was red meat. Eating it in moderation is great. Eating it in the quantities I was eating it was raising my iron and raising the burden on my liver. And what I found out, not just from my current blood test through your program, was from my DNA that I needed to tend to more vegetables, fiber. I needed more fiber in my diet, and I needed more fish. And I have a hard time digesting saturated fats. The other insights to my genes that was really interesting is anyone who knows me knows that I need my sauna every single day.
Mhm.
Every single day. My husband, he uses it, but he's fine without it. I was told that I have a hard time producing heat shock proteins. And the prescription literally said use infrared sauna, which was eye opening. The other thing that was really interesting is that I have no ability to break down BCAAs. So if I were going out to take a supplement of BCAAs, it would have only made me worse and it wouldn't have worked, right? Couple other things, like you mentioned, like your family member, I have the ApoE gene. And I went to my 82-year-old set of parents and I said, not that you guys are going to change anything about what you're doing, but I have 3 siblings and we probably want to know more about your genetics that you're passing down to us, because now I know that one of you gave me this gene. And you better believe that I'm doing everything in my power to prevent that. And I wouldn't have known that from my blood test or from the way my brain feels, because I feel good. But it's those little things that, okay, so that's not a death sentence. That doesn't mean I'm absolutely going to get it. It means that I now can take control over the predisposition at the age of 48 and prevent this from happening. And it's not just about dementia, it's about any chronic disease, cancers, you name it, correct? And I'm sure you're seeing so many people shift their lifestyle with the hopes of prevention, but then you're also getting these other benefits, like the people that you mentioned, the weight loss that just came with it, which getting off the medication. And what about the side effects of the medications that they had been on that we're not even talking about? So it's almost like this domino effect and giving people control back.